I am here to tell you that it made a difference. The last 4 months of my life compared to the last 2 years is night and day. I mean, I don't know how else to say it. I see hope where I saw none. All I saw was expense and pain. I just can't say enough about Dr. Caprell or this procedure.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Dave Hendrick. On today's episode, we speak with Jim Rory, a longtime private investigator whose life and work were disrupted by chronic low back pain following a car accident. Like millions of people living with chronic back pain, Jim tried a range of treatments, including physical therapy and nerve blocks. While those approaches provided temporary relief, the pain always returned. Seeking another option, Jim turned to Dr. Leo Caprell at the Carolinas Pain Institute in North Carolina, where he became one of the first patients in the United States to receive commercial treatment with the FDA-cleared FUSMobile Neurolyser XR, a non-invasive focused ultrasound system. Jim shares what led him to the procedure, what the treatment experience was like, and how it has affected his pain, his work, and his quality of life. Well, Jim, first of all, thanks for being on the podcast. We're really excited to have you on Curing with Sound.
Thank you very much. I'm glad to be here.
To begin, can you just tell us a little bit about who you are and what you do?
Well, I'm a professional licensed in North Carolina private investigator, and I have been since I was 19 years old. I'm 60 now, so I've been a private investigator pretty much my whole life, since 1985, actually. And I'm engaged to be married to a lovely lady here in Hamptonville. My career, me being a private investigator, that's just who I am. I mean, after that many years, it's just part of who I am. I'm really not looking forward to giving it up. One day it'll have to happen, but for now, I enjoy my work.
Well, because you are the first private investigator we've ever had on the podcast, was hoping you could just tell us a little bit more about your work, because I think people have a conception from TV and movies, and I think you're going to tell us that it's maybe not as thrilling as we might think it is. But what do you do?
Well, I mean, that's what I tell everybody, because a lot of people call and they want to be a private investigator. Are you hiring? Blah, blah, blah. I was watching TV and that was so cool. And I tell them there's no red Ferraris in the driveway. There's a lot of stress. If you care about your job, and this with my job or anybody else, and you want to do good, there's a lot of pressure on you to accomplish what your client hopes you can accomplish. And all the time trying to be compassionate with their issues that they're having, if it's husbands and wives or child custody. But it's fulfilling. I've helped a lot of people over a long period of time. Like I said, I'm working on 40 years of doing it. Save kids out of bad situations. Located people that were just gone. Somebody's trying to find an old family member. That's always nice, where you can. They tell you, I need you to do this, but I doubt you're going to be able to. And then when you can, and you can put two people back together, that's pretty cool.
Jim, we are talking to you today because you're one of the first people in the United States to be commercially treated with a focused ultrasound device for back pain. Can you just tell us the origins of your pain?
Sure. It's your typical rear-end collision. It was back in 2023, November 17th, actually. I had crossed a really busy intersection, and I'd heard an impact behind me. I was actually on the phone with another investigator, and I said, well, somebody just got creamed. And about the time I said that, I was rear-ended. I was across the intersection, and as I was checking my mirror to see what was going on, an older gentleman in a white Honda CRV had caught up with me and crashed into me. So I started trying to get off the road, obviously, and he crashed into me again and again until I finally got pulled over onto the curb. I could not imagine what was going on, but I stopped and I saw him coming up to stop behind me. So I go to get out of the car and he hits me one more good time just to, so I was in a twisted motion, I had my left foot out of the door and was coming outside the car, and he rolled into me and smacked me again. And through it all, that's where everyone's decided that's where the actual injury occurred. The sudden jar, and then me being in a twist anyway.
And was it instant pain, or was the pain something that developed over time?
No, it wasn't instant, because after we cleared things up with the police report and all that stuff, I chose to go to my insurance agent. Insurance advised me, go by, get checked out, because, you're going to get stiff. You are impacted. So I went to the local emergency room in Clemens, met a doctor, and he said, I had all the signs of maybe some whiplash, some bruising from the seatbelt. And I explained to him how it happened. And I was starting to feel some pain in my left hip, groin area, and around the bottom side of my back. So, and he was just, Advil, probably some muscle tears, we'll take care of it. And he said, follow up with my primary care physician if I didn't start feeling better, which after about 2 days, and I couldn't lift my left leg, couldn't bend over, I made an appointment with my primary care. So it took a day or two to really set in, but I literally just quit being able to dress myself almost.
Yikes. And so how long does that pain last before you go seek additional treatment?
Oh, well, my primary care automatically, I had kind of a timeline here. He suggested I start some PT. And I think that's kind of the procedure these days. Everybody has to do PT first. And I think the PT helped my hip a little bit. I don't even really know what they said was wrong with my hip. But the lower back pain, I don't think PT did anything. And I did PT for months and months and months. I would get disgusted with it and quit, and then go back, quit and go back, to the point that finally one of the PT people said, maybe you need to go get an MRI, which I did do. The MRI didn't really show anything wrong with my spine, which I'm grateful for that. I'm grateful I don't have serious, surgery problems. It's soft tissue. After that, more PT, and I just wasn't getting any relief.
And at this point, your back hurts.
My back hurts a lot. I'm using a heating pad all the time. And if I can go a day or two without working, which my work consists of probably 90% sitting in the front seat of my car. And I literally couldn't do that 2 days in a row, which is expensive for me because I'm having to put cases off. But if I pull an 8-hour surveillance day, I could not do it the next day. I was letting the yard work go. I was doing none of the things I hear that I love to do. I live with my fiance. She's got a beautiful piece of property, and I took it on myself 5-6 years ago to start taking care of it. And now, we were turning into a jungle and all that crap. So I had to space my work out to limit it to one day, if it was a short little thing, run out and check on something quick, easy. Sitting in front of the desk, easy enough to get up and walk around, move around. But the constant sitting was just really painful, really painful.
So this month, we're a few months removed from the accident itself, and it's really starting to affect you, sounds like, personally and professionally.
Personally, it was affecting me a lot just because I try not to be a person that sits around and complains a lot. And it is just me and Lisa here. So I was starting to feel pretty bad about her having to listen to me groan and complain. I was prescribed some pain pills, the easy kind. I don't do opioids or any of that. BC arthritis strength seemed to be the only thing that worked for me. And every time I'd see a doctor, they'd be like, don't take BC, it's killing you. So it was pretty much just suffer through, just deal with it. To the point that, like I said, I was seeing different doctors trying to find an answer. And then I was finally referred to a Dr. Oliver for a nerve block.
About 8 months after your accident, you're referred for a nerve block.
And full disclosure, once again, I'm paying for everything out of my pocket. I'm working less. I'm starting to panic. And I hate needles with a passion. So I had those three things telling me this might not be what I want to do. But I did like Dr. Oliver. She's a nice lady. And she sold me on the fact that it could be done. So we decided to do the nerve block. And my first nerve block was February 6th. Within a couple of weeks or within a couple of days, I felt good. I did. I felt like we'd found an answer. And I was told, of course, at that time that nerves heal. You're going to have to do this again, more than likely. That there's no set standard. It depends on your body. When's that nerve going to heal? So after I started feeling better, within a week or two, I started thinking, okay, that needle was not that bad compared to not hurting all the time. But it came back pretty quick. It came back within like 3 weeks.
Shoot. How'd that feel when you suddenly started feeling bad again?
David, I was so discouraged.
Yeah.
Really felt let down. But yeah, I was very discouraged.
And even though it wasn't providing you lasting relief, it was providing some relief.
It was providing some relief. And I guess in my brain, I'm thinking, well, maybe we'll get it this time. Maybe we'll do it this time. But I had let's see. So I had the one on February 6th, another one on May 7th, 25, June 9th, 25, and July 16th, 25.
So almost every month, it sounds like.
It was close to every month. Very discouraged to the point of me saying, no, I'm not going to do this anymore. I would rather walk with a cane than continue to give money, the kind of money that I can't afford, and put up with the pain of the initial injection just to have it come back a month, 2 months later. Just not worth it.
So at this point, it sounds like you're very frustrated and you decide to call Dr. Leo Caparol at the Carolinas Pain Institute, as he's someone who you are previously acquainted with.
And I called him and left him a message, reminded him who I was, and darn if he didn't call me back the next day. And he sounded very concerned and said he would like to see me, and made an appointment for like the very next day, which out of 2 years of dealing with doctors, that doesn't happen.
Wow.
And I had sent over to his office my medical records, file on file, He had taken the time to look at all that stuff. And so he understood my situation. And he said what he saw as far as these nerve blocks were going, they were not doing what he would have done. And I'm not going to beat those doctors up. He saw that more direct work needed to be done above and below where they were punching at, so to speak. And then he started telling me about this new procedure that we're here to talk about today. So a lot of it's going over my head, but he's explaining things to me, and he is excited about this. And again, I go back to his compassion about people, and I could tell that he knew this is something that was going to be a big deal in the industry.
So Jim, just to give our listeners a little context, we're talking about the recently FDA cleared focused ultrasound treatment that Dr. Caparol and his team are using to non-invasively treat back pain. Now, take us back to the day of your procedure. You walk into the clinic, and what happens from there?
Well, I stepped into his office, and they directed me right back to the back, where they put me in a little, curtained off room, and just told me to wait because there was some paperwork to sign off on. I guess I'm a guinea pig. I got to sign off saying, whatever. And lady comes in and introduces herself to me. And of course, I don't remember names, but she told me that, asked permission to do the video and wanted me to consent to that. And I was like, yeah, that's fine. Darn, I shouldn't have worn my Spider-Man underwear. I knew what was coming, but she was a very nice lady. I signed off on, the paperwork. And probably within just a couple of minutes, I remember Dr. Caprol coming back there to say hello to me. He already had his lead vest on and said our hellos. And he was excited. And I think I was too. There was still the apprehension of the pain. I'm still, after the nerve blocks and stuff, I'm not looking forward to it. But I was happy that they told me I didn't need to have anybody drive me home. I felt like that was a sign that I wasn't going to suffer, but somebody came to get me, walked in, and there's this equipment, the thing hanging over the table, and they're explaining what's going to happen to me as I'm basically just pulling my shirt up and lowering my britches a little bit, laid face down on a table. Dr. Caprol is talking to me the whole time, and they place an object on the lower part of my back. I can feel that. And I remember thinking I could live with this for the rest of my life for what it was. But there was pressure on the point where my back hurts. I could feel it. But it was not a needle. This was somebody with soft thumbs pushing into my back. And I think I felt a little heat. But this was easy. And again, he's talking to me the whole time. But this was a procedure from start to finish. Gosh, just a few minutes. And he said it went great. Spoke to a few of them. They asked me how I was feeling. No lightheadedness, anything like that. I mean, literally nothing happened to me. They turned a light bulb on me as far as I knew. I was a little doubtful at that point, because it was so simple, and when something happens, you've been experiencing the nerve blocks with the needles, and then to get up and feel fine. I thought,
you're thinking that's it?
Yeah, exactly. How could that help? You didn't do anything to me. You didn't break the skin. There's no blood. I was wrong, because on the way home, I'm thinking I'm more comfortable seating, because I've learned to hate that seating in the car. I sat in so long and caused so much pain, but I didn't know if it was in my head or not, that I could actually feel some relief. So I went home and just rested the rest of the day. And the next day, David, I felt good. I felt good. I won't say I felt better or worse than I did the first day after the nerve block, but it was the second day and the third day when I'm like, I'm going to go out and spread mulch. I'm going to start doing things that I can't do because I feel fine.
That's exciting.
It was really exciting. I'm a private investigator. I've worked more workers' comp cases than I care to think about, where I catch the guy that ain't supposed to be doing something and he's building a house, playing basketball or whatever. And that was in the back of my mind. But I was like, no doctors told me not to. Actually, they told me exercise, get some exercise. So I was like, I'm going to work until I can't work anymore. And I did. I started losing weight again. I was feeling really good. And up till probably a month ago, did I feel my first little twinge. And it is because I've been working a lot. I am doing some overnight surveillances, long days. And I am taking care of the yard. Like I said, I'm never going to let the yard get back in the shape it was in, because I know that procedure's out there. I'm grateful that I thought of Dr. Caprol, and I'm so grateful that he was there for me. And he cared enough to get me in there. And I do. I thank God that this procedure is available now.
Incredible.
But I am here to tell you that it made a difference. The last 4 months of my life compared to the last 2 years is night and day. Yes, I'm healing, and yes, I'm feeling the pain coming back. I had an 8-hour day in the car 2-3 days ago. I didn't want to work the next day. I could feel it coming back. I feel like that if I can have this procedure done every 4 months, every 6 months for a while, and then maybe once a year, I see hope. I mean, I don't know how else to say it, where I saw none. All I saw was expense and pain with the nerve blocks.
Sounds like the future looks brighter.
Definitely. Like I said, up to that procedure, it was pay for something that you get very minimal results for. And two, it hurts. You cannot look forward to getting a needle shoved in your back. If you do, you probably got bigger issues than your back if you're looking forward to something like that. But I do see hope. I don't feel like, and again, I'm just one guy who got rear-ended, but all I can attest to is that it worked for me, and it did give me hope that I have not had for forever.
Yeah, fantastic. Well, we're really so appreciative of you spending time with us and sharing your story. Anything that you'd want to add or have us keep in mind or point out?
No, I mean, we've covered everything regarding this. I just can't say enough about Dr. Caprell or this procedure, because I went through a lot of doctors and nobody mentioned this. Not one. This is, like I said, this is sci-fi. This really did just like blow me away, the ease of it. Is it worth it? Most certainly. That's all I can say. I mean, if you just get one other person out there that's sitting around hurting and this could help them, that's pretty much it.
Fantastic. Well, Jim, thank you so much for joining us on Curing with Sound. We're so glad you're doing well.
All right. Well, thank you, David. I really appreciate your time.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at FUSfoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on Focused Ultrasound. We would also be grateful if you would rate and review the show.